Any type of surgery is scary, I think. And when you say heart, you're like, oh no,
I can't even tell you. It's changed my life. I feel like a new person.
I've had several friends since who have been diagnosed with prostate cancer. And boy, the first thing I do is I raise my hand and I say, you need to find out about the robotic surgery technique, because it's a great way to go.
I think one of the things that's happening here that I think has been very positive is the encouraging of other specialties to take advantage of this technology, and that we now have a multi-specialty robotic program that I think isn't available very many places.
kxly-4 HD presents Spotlight on Health, Robotic Surgery, brought to you by Providence Healthcare.
The words robotic surgery may conjure up for many an alien world where robots perform tasks independent from any human contact. In reality, with the technical advancements that have been made recently in the world of robotics and robotic surgery, nothing could be further from the truth. As a leading robotic surgery center, Providence Sacred Heart Medical Center offers patients the most advanced technology found in the world today. With 3 surgical robots at their disposal, procedures in the areas of cardiology, urology, gynecology, and now head and neck surgery give surgeons the ability to perform procedures more effectively, more safely, and to a broader range of patients. Hi, I'm kxly-4's Nadine Woodward. In the world of medicine, robotic surgery is a relative newcomer, but in the last 10 years, advancements have allowed this cutting-edge technology to radically change the way patients are treated. Less invasive, smaller incisions, and very little discomfort, all leading to quicker recoveries. What was once considered just science fiction, robotic surgery is revolutionizing the way medicine is being practiced right here at Providence Sacred Heart. You have quite the reputation all over the country for your work in robotic surgery. You pretty much are the grandfather of this procedure.
Well, I'm not the grandfather, but one of the early adopters.
Dr. Leland Seeweck's reputation as a leader in the field of robotic cardiac surgery is known around the world, and his knowledge on the subject is extensive.
The initial research that led to that was actually military. And the idea behind it was the potential for doing things like surgery in battlefield situations without having to be there, without having to have the surgeon there, to be able to be somewhere else and controlling that. One of the things a lot of patients and families are confused about is the robot does not work on its own. It doesn't just go and do an operation. And it's also not like the robots that you see on an auto assembly line where it's programmed and it just does a certain thing over and over again. The technical term for what this robot is a telemanipulation system, where the robotic instruments are actually controlled by the surgeon. So it just transfers your motions to those instruments. So it's a live, continuous control of that instrument. It's not acting autonomously.
The initial use of robots in surgery started in the early 2000s, and after FDA trials and approvals, Sacred Heart was positioned on the ground floor of this breakthrough technology.
As far as Sacred Heart and how we got here, a lot of credit, I think, even though we pushed it as surgeons, some of the credit does go to the administration that really stepped up to the plate and took a gamble on a very expensive piece of equipment. I think that's paid off for the hospital, but they have continued to invest in that. We've upgraded the equipment. We've gotten additional robots. We now have 3 robots here to help meet the demand for all the specialties. So, it took a little bit of vision on our part and the administration's to see that there was a future to it. So they have made the effort to make that all work.
With the latest versions of the robot costing about $1.8 million each, it's the commitment to the patient that drives Sacred Heart to keep up with the advancements.
Really what's been most rewarding, in fact, is seeing how well the patients do. That was the primary reason we started. And we were concerned when we started about whether we would compromise their outcomes in order to get little incisions, and that's a trade-off we didn't want to make. So seeing patients do well and get good results that last a long time, have this, exceptionally high success rate of repairing valves, for instance, and closing ASDs and things like that, it's been, pretty gratifying seeing how well the patients do.
So how does this technology work? Well, to find out, we were given a very special tour of one of Sacred Heart's robotic surgical suites. We are in one of the surgical suites at Providence Sacred Heart Medical Center, speaking with Dr. Stephen Brisboe. And robotic surgery, this is where you do your work.
That's right. That's
So
correct.
give us a tour, show us how it's done.
Well, there's three main components to the system that we use. This is the console. This is actually where the surgeon sits and operates the robot using foot controls, clutch foot controls, and hand controls. We look in here and we have a view through the dual camera laparoscope. So we see virtual reality, we see a 3D image, and we can zoom with our clutches, we can zoom our camera in and out so that we can zoom right down on top of the pathology that we're working on so that we can do fine, delicate work.
Wow.
So this is the robot itself, and it has 4 arms. And the central arm here has a dual camera scope, which we insert. And then there's 3 arms for accessory for the instruments that we pass through. And we place these hollow tubes. This is a torso of a mannequin, of course. And we place these hollow tubes under an anesthetic through the abdominal wall. And then we place robotic instruments into these, we call them ports, these hollow tubes. And the robotic instruments, so they're like the human hand.
Oh, but look at how little that is, so teeny.
They rotate in 7 different degrees to enable you to operate at right angles to the tissue, things you can't do with straight laparoscopy.
If you're here and you're looking for the most part through these glasses, for lack of a better term, who's watching the screen? The rest of the staff?
Everybody in the room. You have to have somebody at the bedside who knows the instrumentation. They change instruments for me while I'm sitting over there. They pass needles into me. They retract for me. They enable me to do the procedure that.
Wow. They're actually carrying out what you need to do through the robot?
Well, they are assisting.
Yeah, okay.
And you have to have somebody at the bed. That's key,
Yeah,
critical.
yeah.
You have to have a team of people. Once I put my head in the console here, I have my 3D image, and I click my thumb and forefinger together, then I have control of these instruments. You just have, unbelievable control. If you want to do a running suture, you can do that, or you can, there's just all kinds of things that you can do.
Well, robotic surgery has become second nature to you. Dr. Brisboe, thank you for giving us a tour today.
Thank you.
Truly amazing technology. When we come back, we'll look at some specific examples of how robotic surgery is changing people's lives.
And boy, the first thing I do is I raise my hand and I say, you need to find out about the robotic surgery technique, because it's a great way to go.
Why did the Hospital Value Index rank Providence Sacred Heart Medical Center as the best in value hospital in the entire state of Washington? Because of our quality of care, the superior patient satisfaction ratings we receive, and our leadership in providing care more efficiently so that it's more affordable and more accessible to more people. Providence Sacred Heart Medical Center. Care for life.
Right now, he's not thinking about what would happen if he had a stroke. He hasn't measured the benefits of neuroradiology. He hasn't formed a team of stroke specialists who are available around the clock. He hasn't thought, what if? But we have. It's part of being the region's premier medical center, and why Sacred Heart built the region's only certified stroke program.
Surgery is still the most effective treatment for most gynecologic conditions, but the trauma, pain, and long recovery process can cause significant anxiety for many women. Fortunately, for complex hysterectomies and other procedures, robotic surgery is a much better option. Dr. Steve Brisboe, an OBGYN for 30 years and the medical director for women's services at Providence Sacred Heart, has been a proponent of minimally invasive treatment his entire career. So when robotic surgery became available, he immediately embraced the chance to use it on his patients for procedures like removing fibroids to complete hysterectomies.
A very common scenario is a patient who comes to me and not uncommonly finds our website or the intuitive surgical website and comes and they've seen other physicians who've told them you have to have your uterus out, you have to have a major incision. And when they find out there's other choices, that they can save their uterus if they want, and they can have little tiny incisions, be back to work in a week, go home the same day or the next morning, needless to say, they're pretty happy.
Sharon Davis heard about Dr. Brisboe from another physician who had told her her options for excessive bleeding were limited. Feeling imprisoned by a condition that made it increasingly difficult to leave home or hold down a job, Davis left her doctor's office devastated.
I felt so bad. I felt hopeless. But during our conversation, he had told me that there was another doctor in Spokane, the only other one he knew of, that did vaginal hysterectomies.
Following through on that second opinion paid off for Davis in a life-changing way. Because of her size, a traditional hysterectomy was risky, but Dr. Brisboe was able to perform the procedure using robotic surgery and with excellent results.
And I went home the next day and I never had any complications from it. It was such a wonderful thing. And this is not an easy thing for me to talk about, but it's embarrassing and humiliating and personal, but I feel I have to give back. And I know there's women out there who are suffering the way I suffered. And I need for them to know that there's hope for them. There's a procedure that can help them. And so that's why I'm doing this.
Surgery is controlled trauma. It's traumatic to the body. It's controlled, but it's still traumatic. And the amount of trauma to the body depends upon what type of disease they have, but it also depends on how the surgery is done. So there's a huge difference in terms of the amount of trauma to the body in somebody who has a big incision versus somebody who has 4 little tiny half-inch incisions. Less risk, less bleeding, less infection, faster recovery. Most of the patients go home the same day or the next morning and are back to work within a week.
I am so blessed. I am so blessed, and I'm so thankful for this technology and Dr. Brisboe's tenacity and his desire to help. There's nobody else that I know of who's gone this far and gone the extra mile to try and help somebody. I just love that man. He's a great man and a great person and a great doctor.
It's a challenge, but you're supposed to enjoy what you do, and I enjoy what I do.
And never stop learning.
I never stop learning, absolutely.
From conditions that affect women to those that affect men, robotic surgery is also used by urologists to treat everything from prostate cancer to kidney tumors, and with excellent results. Robotic surgery is nothing new to Spokane urologist Dr. David Mickelson, who has been using the cutting-edge technology for more than 6 years.
I always tell people you're going to get the best result if you have somebody do the procedure that's done a lot of these procedures. You're always going to find someone that has done more. We've probably done several hundred now here at Sacred Heart. There's people around the country that have probably done well over 1,000. But we have a very good experience here in Spokane.
Robotic surgery is ideal for delicate urologic surgery, where doctors work in very small areas, surrounded by nerves affecting urinary control and sexual function. And with just a few small incisions, very little loss of blood and downtime, patients are able to get back to their normal routines much quicker.
It's always been my impression that one of the things that I had to do is talk people down, from their enthusiasm for the procedure, because to some degree this is still surgery. It's still a very big operation. But I think for the most part we can say that, number one, the incisions are smaller, so people tend to recover a little bit quicker. They go home from the hospital maybe a day or two sooner. once we get their catheters out, which typically stay in a week to 2 weeks after the surgery, they seem to bounce back a little bit quicker. So pain medication use is less. Those incisions tend to heal up a little bit faster.
And that's exactly what Spokane businessman Ed Clark wanted when he was diagnosed with prostate cancer 4 years ago. Clark also did his own research.
I was interested in a great outcome, number one, but I was also interested in nerve-sparing surgery because I didn't want to lose everything in my life, and so I decided that was the best way to go because it was so precise.
Clark was back to work in just 3 weeks and with very little pain or discomfort. He now readily recommends the robotic procedure.
I've had several friends since who have been diagnosed with prostate cancer, and boy, the first thing I do is I raise my hand and I say, you need to find out about the robotic surgery technique because it's a great way to go.
It's always very satisfying to walk in the day after surgery and see people in very little pain, having had very little blood loss, and know that they could potentially go home that afternoon after spending one night in the hospital. And I've been around long enough. When I was in residency, these patients would oftentimes be in the hospital for a week to 7 days.
They were all really professional. They all had my best interest at heart, and I really appreciated them.
Coming up next, we'll take a look at the newest in robotic procedures and the program that launched it all.
Any type of surgery is scary, I think. And you know, when you say heart, you're like, oh no, you know.
Right now, the last thing on her mind is a hospital. She isn't weighing the advantage of board-certified emergency physicians, hybrid surgery suites, or whether she can get all the specialized care her family may someday need under one roof. Today, she's not focused on any of that, but we are, which may explain why U.S. News & World Report rates Sacred Heart best overall hospital in Spokane.
Here, you'll find the only children's ER in the area, the region's only children's cancer program, and the region's only pediatric intensive care. Here, over 120 specialists dedicate their lives to making sure our children don't have to leave Spokane to receive the care they need. Right now, right here. Sacred Heart Children's Hospital. World-class healthcare, just for kids.
With advancements happening in robotic surgery every day, new specialties are beginning to emerge. One such specialty is the area of head and neck surgery.
With our newly expanded services, what we're offering is a true tertiary approach to head and neck surgical problems. These are both cancerous as well as non-cancerous.
Can you tell me how robotic surgery has changed what you do?
Yeah, robotic surgery has been around for a while. Has not been available for head and neck surgeons to use up until the last 6 to 9 months. And it is going to allow us to do procedures in the mouth, in the throat, and in the voice box area without having to make incisions on the neck or on the face, and working through the mouth to get to these areas that really your hand and your wrist can't get to work.
For Doctors Mitchell and Bunn, the robotic surgery advantage will definitely give their patients a much easier road when it comes to recovery and appearance.
The biggest benefit is getting better function because you're doing a less invasive procedure, and hopefully we're going to be having better function because we're able to save more of the non-cancerous parts of the mouth and the throat and the tongue.
The real benefit, particularly with the transoral robotic treatment of throat and voice box region cancers, is that we're able to access areas that previously were only accessible through much larger surgeries that had long hospital stays, typically pretty involved surgeries, oftentimes 8 to 10 hours in length. These, because of the extent of these surgeries, they often required extensive reconstruction due to what was removed.
Robotic surgery of the head and neck may also play a big role in helping to solve a problem suffered by many: sleep apnea.
We're real excited about the prospects for the surgical treatment for obstructive sleep apnea compared to the methods that we have now. when patients are laying down flat, typically the tongue and throat tissues collapse against the airway, and that's where the obstructive causes are for a number of patients. So while not all patients with obstructive sleep apneas will be good candidates for this type of procedure, what we are finding is that we're able to access areas to surgically treat the obstruction that's causing the underlying sleep apnea.
So what does the future hold in the realm of head and neck surgery?
I think it's just an exciting chance to bring new procedures in that are exciting because there's new technology, but also exciting because we should see some significant improvement in patient morbidity and how they tolerate surgery, how fast they're back to eating and talking and feel like they're back to their normal selves. And I think that will improve that dramatically.
Providence Sacred Heart acquired its first surgical robot back in 2002. And through the leadership and skills of surgeons Leland Seawick and Brandon Reynolds, they have performed more than 400 cardiac procedures since that time. It should come as no surprise then that their skills and expertise, not only as surgeons but teachers, is known worldwide. You've really made a name for yourself in this whole area of robotic surgery. And
yeah.
You've done very well.
You know, that's been a fun part of it. I'm at a point in my career where things were getting pretty routine, you know, not in a bad way, but, you know, I was in practice for a pretty long time and thought I'd had it all figured out, you know. And then you do something totally new and it's out of your comfort zone and you're learning new things and in fact trying to help develop new technologies and it's been successful and it's been an exciting part of my career to become well known. This patient again has a rhythm problem but also has this leaking mitral valve, but we're looking at
being well known in the field of robotic cardiac surgery is just part of the program for Dr. Seawick. Helping to teach and train robotic cardiac procedures and techniques gives him the greatest satisfaction.
Pretty much every meeting I go to, I'm meeting with people that came here and watched us operate or we helped train. And, you know, from some of the major institutions around the country, the Cleveland Clinic, the Mayo Clinic, Cedars-Sinai, those are all people that we help get their program up and going. Places you'd think would have been doing it before us. But in fact, sometimes it takes an environment like this to make the effort and get it to work. I'm Dr. Seawick, and I have with me today Dr. Ishikawa and Dr. Ino from Kanazawa, Japan. Dr. Ishikawa has spent a fair bit of time working on robotic heart surgery, and they were recently in a meeting on the East Coast and felt like before they headed back to Japan that they should stop by and visit us here in Spokane.
I'm Ishikawa from Japan. Today we visited here for case observation. And Dr. Seawick is a leader in the field of robotic cardiac surgery. So we'd like to learn about robotic surgery.
Entertaining surgical teams from around the country and even around the world is just part of the teaching of Dr. Seawick and Reynolds. Recent trips to China have brought their expertise into hospitals there, as well as to help spread the technology. But the bottom line reality of all of this comes back to a singular goal. So it must be very rewarding then for you.
It is. It's been rewarding in terms of, you know, the reputation and the contacts that I've made, but really what's been most rewarding, in fact, is seeing how well the patients do.
Performing open heart robotic surgery on patients is really what drives the team at Sacred Heart. And while not every procedure can be done robotically, the ones that are tend to have terrific results.
Between Dr. Reynolds and I, which are the two cardiac surgeons here that do the robotic heart surgery, we're doing a little over 100 a year, about 110 robotic procedures a year, which is about, in fact, 10% of all the open heart surgery done here at Sacred Heart. So it's a pretty significant portion of what we do. The most common thing that we do and the thing that we're more known for here in Spokane is mitral valve repair. The mitral valve is inside the heart. The robot allows us to have this really excellent view of the valve, and the little instruments allow us to really do some pretty delicate work on the valve. So we do almost all of our mitral valve repairs robotically, and that's the most common procedure that we in heart surgery use the robot for. The other things that we do, the robot works very well for, they're just not nearly as common. Things like tumors inside the heart. We also close holes in the heart, defects in the septum, the wall between chambers in the heart. We can sew those holes closed. And lately we've been doing some more rhythm surgery. Atrial fibrillation, which is an irregular heart rhythm, is a quite common problem, and there's been a reluctance to send people to surgery because it's so invasive. As we've been adapting techniques to do that robotically, it's becoming a little more acceptable procedure, and we're doing more and more of those all the time. And the big advantages for patients with a robotic approach, particularly mitral valve repair, is avoiding that big incision in the middle of the chest, avoiding opening the chest. Our patients get back to pretty normal activities quite quickly. In fact, we don't restrict their physical activities at all. There's some discomfort, and so it usually takes people a couple weeks to do what they want, but we don't actually limit them. If they want to play tennis or go skiing or whatever, and we've had people do that. We had one young woman who we closed a hole in her heart, and she was playing soccer 10 days later. Wow. So that's a big advantage. The most important thing for someone with a leaking mitral valve is trying to get it repaired instead of replaced. The success rate of that varies a lot around the country. It's mostly dependent on the skill of the surgeon doing it. Since we've been doing it robotically, our success rate has been better than ever, and is about 99%. An even more important advantage than avoiding a big scar is coming out with a successful repair, and the robots really helped us do that because we can see and work on the valve so well.
For a patient like Patty Holton, who actually works in Dr. Seewick's and Reynolds' office as the practice coordinator and has had the mitral valve repair, it is those kinds of results that speak volumes and speaks to the kind of surgeons she works for.
They've done, I think, awesome wonders with the robotic procedure. Any type of surgery is scary, I think. And when you say heart, you're like, oh no, these guys do this every single day. And I think to make the healing process of it so much better than to have your sternum cut open, which takes a lot longer in the hospital. There's a lot more pain involved because now you're just like not moving around, and different things like that. Going into just having 5 little portholes, from your armpit down and around, and you're up and ready to rock and roll 3 days later. I mean, how awesome is that?
And for Carol Merritt, whom we have seen being operated on for mitral valve and atrial fibrillation by Dr. Seewick, the process was easy.
When they say heart surgery, you immediately think of the zipper down the chest. And I was really frightened about that, and I thought, oh gosh, can I do this, They had decided I was a candidate for the robotic surgery. It was just like it brought a peace over me, and I was okay with it. I never was frightened after that. The process was very pleasing. I'm really glad that I've had it done, and so I've been very pleased.
There's probably a dozen people involved in doing one of these procedures, and they all have their roles. And when we started, it all took a long time. It took us all day to do one of these procedures, but now everyone knows their role. Everyone's good at doing it. Things move along, and these operations now don't take us really any longer than a conventional operation. And not that much quicker because there's a lot to do, but the operations are fairly routine at this point.
They're both down to earth, very caring. For them to be able to bring that type of work with that type of science here in little old Spokane, it's changing a lot of people.
As you've seen in this last half hour, the robotic surgery program at Providence Sacred Heart has developed into a regional center of excellence, attracting patients from all across the country. You could call it the robotic revolution. I'm Nadine Woodward. Thanks for watching.